As I grew, though, I started to be a little bit more cognizant about healthcare, right? I started to notice that all of the doctor's appointments my mom took me to were on the better side of town, more specifically in Westchester, right? I started to understand that the folks that were my friends growing up, my classmates, my neighborhood friends, they didn't have access to the same kind of care that I did. And I started to wonder why that might be. And is it just because my mom is anal retentive? No. But my mom didn't have a language barrier. We had access to a car. We had access to knowledge. We had healthcare professionals in our family. And we had champions that really, really cared about our health and were educated well enough to know the difference. When I got to high school, I think it was my 9th grade year, I took my first health class. And I started to understand, as I was in a private school in New York City, and one of only 2 people of color in my grade, that a lot of the afflictions and the chronic diseases that we were learning about, I knew somebody or somebody in my family who was afflicted with them. And I started to notice that that wasn't the case for my counterparts. And I started to put the puzzle pieces together as to why could that be, right? Why is it that me and the folks that I know and the neighborhood that I'm in and the zip code that I occupy are disproportionately affected with the diseases that I'm learning about in these classes? And when you start to think about those things, you start to put those puzzle pieces together, I think you start to realize that health equity is a thing. And now, I'm not going to tell you how old I am, but I'll tell you that health equity wasn't the topic when I was in school, right? And so, as the son of immigrants, it was doctor, lawyer, engineer, right? Masters in public health wasn't on the table. But as I grew and became more literate and became more aware of the situation, I kind of naturally found myself moving towards health equity, right? Or equity in spaces in general. And so a little bit more about me. I'm educated as a biology student. I was on the pre-med track. I kind of wandered into a laboratory one day and fell in love with the bench, and then it took me a long time to get out. I'm formally trained as a vaccine scientist, hailing from Pearl River, New York. It's our Pfizer's vaccines headquarters. I've worked on all of the vaccines that have come out in the last 5 or so years, including the COVID vaccine, but more specifically, my baby's RSV. That one's actually really cool, disproportionately affects people of color, especially infants. And scientists have been working on that one since the 1950s. We were the first company to get an approval for a maternal vaccine for RSV. You clap again for that. Okay, good. Now you're with me, all right. A little over a year ago, I decided to join or leave the laboratory and join the CEO's office to work on an initiative, the Pfizer School of Science, where we strive to educate young students, the middle school age in New York City, and get them excited about careers in STEM. You guys are probably familiar with early talent pipelines, right? And folks that are getting the next generation